So the brain essentially starts to overfire and it gets more sensitive. So that is why people end up getting more and more headaches, and medications stop working. So that leaves us in a situation where we need to look at different ways to make the brain better. Fortunately, we've learned a lot about how the brain heals in the past decade or two. And there are really a couple of different components. Number one, we need to revitalize brain health with nutrition and food and supplements. And second, we need to remove toxins. We all know that we live in a toxic world. Many of those accumulate inside us without us knowing and end up causing a significant part of our headaches. And then the final factor is that our nervous system can become shifted into fight or flight without us knowing. Even if our life isn't stressful, the process of having frequent headaches is. So that alone can shift your body into fight or flight. And then we need to learn specific tools to take us out of that stage and put us back into parasympathetic, which is where healing happens.
Okay, great. So can we unpack a bit, because there's a lot of information. So first of all, we talk about chronification, and how do people, how would I know if I'm suffering from migraine headaches? How would I know that I have what's called chronification?
Yeah, you can suspect it if you are having more than 2 to 3 headache days a week, meaning any kind of headache throughout the course of the day, whether you feel like it's migraine or tension or sinus or whatever it feels like to you, the same processes are still happening in your brain. I also developed the headache quiz, which is at theheadachequiz.com, to give people a sense of whether or not they're in chronification. And if so, what tips are available to them based on their stage.
Yes, we're going to share that. And I know you have a free gift for our audience to learn more about it, right? So we'll share about that later on. And so, awesome. So let's unpack what you were talking about, first of all. So when you talk about how people can start to, heal their headaches when the medication is not working anymore, you talk about the Reboot Brain Protocol. And so let's start with the first component of it, lab testing. So how do we reveal the information?
Yeah, there are markers of the nutritional status of the brain and the body, of inflammatory markers, stress markers, detox markers. So there are a lot of things we can look at to figure out where to focus our attention as we're trying to help people heal. And that's the purpose of the labs.
Okay, great. So first we learn what actually is going on. We get the data. Mm-hmm. And then you mentioned that the third part is revitalize, right?
We do revitalize next after reveal. We figure out what you need, and then we revitalize with supplements and food. And then the third step is actually remove.
Okay, so R. So when we talk about revitalizing, so what kind of nutrition actually helps? And I know you also mentioned nutraceuticals, right? Do I pronounce it well? Mm-hmm. So I would love to understand a little bit about more.
Yeah, so the brain does have different nutritional needs than other organs in the body. So for example, studies have shown that 80 to 100% of people who have headaches are deficient in magnesium within the brain. You may not pick it up on a blood test in the arm, but very detailed studies of the brain have made us aware of this problem. So most people with headaches need more magnesium. So that is one of the elements that we focus on, both in the form of nutraceuticals and in food. So that may look like taking a supplement of magnesium glycinate along with eating foods that are high in magnesium. So spinach, almonds, things like that.
Okay, so nutraceuticals are basically pharmaceuticals that provide more nutrition to the body. Is that correct?
Yeah, sort of supplements that we're using with a medical purpose.
Okay, great. Okay, so and then remove toxins. So I know toxins are a big issue for in our society in general, where we live in our world. How do we go about it? We cannot avoid them, but how do we remove them?
So our body has several natural detox pathways. The most important of those is the gut. So there's a very specific process that we need to go through to clear toxins out of the gut and prep the gut for the detox, do the detox. It's a very complicated process, actually. So it takes about a month or so to do that.
Okay, so are there any specific steps to it that maybe you can tell us more about, if possible?
Sure.
I'd love to.
So one of the most important first steps is to remove common food allergens, because this is often irritating the lining of the gut and contributing to leaky gut. So the most important of those is gluten. And I know that for many people, they feel like they don't have celiac, so they don't have to worry about gluten. But I would suggest that if you are going through a period of healing and you're trying to remove toxins from your body, you do need to set gluten aside for a couple of weeks, because we know that it contributes to leaky gut. It irritates the lining. There's only one cell that stands between the contents of your intestines and your bloodstream. One cell. That's really not much. So it's pretty easy to damage that cell. Gluten is a very common cause of this. So removing irritants is our first step that we need to do.
Okay, and then we go through the detox and helping the body clear up the toxins.
Yep.
Okay. Are there any specific things that you would recommend if we're thinking about, actually not putting too many toxins into our body, just as prevention?
Sure, yeah. And I think the two places to concentrate are with eating organic fruits and vegetables for the things that matter most. So imagine the fruit or vegetable in the field, and if somebody spraying it would spray a part of the plant that you're going to eat, then buy organic. So for example, strawberries, the berries are just sitting there on the ground, right? They get sprayed. So definitely buy organic. Bananas, not so much. You're going to peel it. You're not going to get the part that they spray any pesticides on. So I think that's the most important thing that matters when it comes to eating organic. And then the second thing that people don't realize is that our skin absorbs so much of what we put on it. So for example, even when somebody comes into the emergency room with chest pain, we put a paste on their chest that's a medicine, nitro paste. So that's how absorbent your skin is, that people use it as a way of giving you medication even during a heart attack. Wow. So I think we need to be very careful about what we're putting on our skin. You can check products with the Healthy Living app that is put out by the Environmental Working Group.
Yeah, the EWG. I think this is a really good app.
Yeah. Exactly.
Yeah, and I think that's so important. And we talked about women, why are we more exposed to migraine headaches? I mean, think about makeup and all the cosmetics and all the products and maybe even, women tend to clean more and use all the toxins. So I think this is very important too. So I know the fourth step is rewire back to normal pain pathways. I would love to hear more about that. I think this is, this is really like, how do we rewire to actually not have those headaches, right?
Yeah, there are a number of devices that can help us figure out how to shift our heart rate variability. So it's important to point out that heart rate variability is different than heart rate. So we want our heart rate variability to actually be high because that's a marker that we are in parasympathetic. Parasympathetic is where all healing happens. So we want to shift our nervous system there. This is a learned skill. And having a glass of wine and watching TV doesn't do it. For those of you who have devices like an Aura or an Apple Watch or are familiar with HeartMath, you'll know that that does not shift the body into healing mode. So some of the things that we know that can do that are certain types of meditation or yoga, breath work. For some people, it can be things like journaling. It's in many ways, it's an individualized process about what works for people to really shift their body. But we do have a lot of data that things like breath work, yoga, and meditation are incredibly effective.